We've always had an idea of what factors increase risk of prolonged symptoms after a concussion in adults. However, we don't know for sure. We want to validate which factors did in fact increase risk, and then be able to assign a risk score to each individual. We followed almost 600,000 adults with concussion for 2 years. This is the largest cohort of adults followed in Canada. We were able to determine what factors did increase the individual risk for prolonged symptoms, and from that information derived an equation that could calculate a person's personalized risk for prolonged symptoms. So the good news is that over 80% of adults with concussion recover within 6 months. We also found that those who are at higher risk of prolonged symptoms were adults who were older, such as over 61 years of age, went to see their primary care physician more frequently, and had a history of mental illness or psychiatric disorder such as bipolar disorder or personality disorder. We created a calculator tool that any healthcare provider who's treating adults with concussion can use, ideally at the time of diagnosis, to determine if their patient is low, medium, or high risk for prolonged concussion symptoms. This calculator can be used by any healthcare provider who treats adults with concussion, such as family doctors, emergency room doctors, or nurse practitioners. What makes this study unique is that for the first time ever, actual values have been assigned to risk factors for prolonged concussion symptoms in adults. Another thing that's unique about the study is we were able to include seniors in it, who typically are not involved in research in concussion. And based upon our findings, further research in this particular population is definitely warranted. What makes this calculator significant is that it can be used, ideally at the time of diagnosis, to calculate the patient's risk of prolonged symptoms and then tailor the treatment plan for that patient. If a patient is deemed to be low risk, the healthcare provider can provide some reassurance, validation, and encourage a gradual return to activity. If the patient is deemed to be higher risk, the healthcare provider can proactively manage any underlying factors that might increase risk of the prolonged symptoms, and also initiate appropriate referrals. This may enable the patient to return to activity sooner. What's really exciting about this is that for the first time ever, a healthcare provider can calculate the absolute risk of prolonged concussion symptoms in adults, use this information to tailor treatment, and support a faster return to daily activity.